Now I'm going to show you how to do an acid-fast stain. I have already prepared sputum slides for you, and they already are heat fixed. So ordinarily you would make a smear and heat fix it, and then start your staining. The staining procedure is very simple. We start off with carbofucin. Just cover the smear with however many drops it takes to cover that smear. Leave it on there for 3 minutes. After 3 minutes, you want to rinse the carbofucin off the slide and shake off the excess. Then you want to use acid alcohol for a destaining step, and you just add a drop by drop until the pink or the purple stops running from the smear. And it looks like it's going to take 6 or 7 drops maybe in this case. Then you want to rinse the slide immediately again. Shake off the excess water. And the last step will be methylene blue. And you're going to cover the smear with the methylene blue and leave it on for 1 minute. After 1 minute, rinse off the methylene blue from the slide and shake off the excess water, and then blot it gently with a Kim wipe until it's dry. And then you're going to look at the slide under the microscope using low power and then high dry, and then you must use oil immersion to see the small acid-fast bacilli, which will appear reddish, and the non-acid-fast bacilli will be blue, and all of the background material will be blue also.
Tuberculosis, also known as TB, is spread through the air from one person to another. When someone with pulmonary TB disease coughs, TB bacteria are expelled into the air in tiny water droplets. These droplets can remain floating in the air for several hours, making it possible for someone nearby to inhale them. Once a person has breathed in droplets that contain TB bacteria, they travel down the trachea and enter the lungs, where they collect in the alveolar sacs. Once in the alveolar sacs, the bacteria begin to multiply. The body's immune system starts working and macrophages begin to surround the bacteria. A granuloma is formed to keep the bacteria from spreading. The TB bacteria remain in the lungs, but the body is protected from disease by the granuloma. In 8 to 10 weeks, the person will most likely test positive for latent TB infection. The progression from latent TB infection to TB disease occurs when the granuloma break open and the TB bacteria multiply. Then the person becomes sick with TB disease and may be infectious. This progression can occur immediately after infection, many years later, or not at all. When the TB escapes from the granuloma and begins destroying a person's lungs, it's called pulmonary TB. TB bacteria can also enter the bloodstream and travel to other parts of the body, causing extrapulmonary TB.